This video will be over the tools and steps for a crown and bridge delivery. First, place your topical on the injection site. You will then pass the aspirating syringe to the doctor for him to place. You will then take the air-water syringe and HVE to rinse and dry the mouth. You will then pass the hemostat to remove the temporary crown. Because of their locking mechanisms, this ensures for a safe retrieval. Once the temporary crown is safely removed from the patient's mouth, you will then pass the Explorer and mouth mirror. We are now going to pass the cotton pliers to deliver the prosthesis for our preliminary try-in. This is an accurate reproduction of the patient's tooth. During this step, we are going to make sure that the preliminary crown fits the tooth properly. We can do so by checking the occlusion with the articulating paper and checking the interproximal contact areas. This step is crucial before we mix and place the cement. Now that the adjustment for the preliminary crown is completed, we are going to dry and prep the tooth for cementation. By taking a small mixing pad and a dental spatula, we will take our zinc phosphate cement and create a luting consistency. Once we have our luting consistency for our cement, be sure that the tooth is isolated. We will then pass the spatula and cement to the doctor, in which he will then place into our crown and place that onto the tooth. You will then grab the wooden bite stick and place it into the patient's mouth. The function of this is to seat the permanent crown while the patient bites into a centric occlusion.